II, we declared war. The country was behind us, and we won. We didn't declare war in Afghanistan, and yet we had this terrorist problem, and what our brilliant federal government decided to do was to go into Iraq and overthrow Saddam Hussein, while the terrorists, as far as any of us know, were supposedly in Afghanistan. This is why these type of things have got to be debated by Congress. The Congress represents you, and your sons and daughters who are involved in these activities, these military excursions, they need to have a voice. We need to come together as a country. We need to come together as a country and follow the U.S. Constitution. If we're going to go to war, I don't care war against who, it's got to be debated, and then it has to be declared. Constitution says so. We keep doing things that we don't follow the Constitution, and it gets us in trouble. And now we've got foreign entities who understand that we have a Constitution, and they also understand, well, but they don't care about the Constitution because they violate it all the time. They all know that. They knew it in Vietnam. They knew it in Korea. They knew it in Kosovo. I mean, the list goes on and on and on. And then we wonder why some of these nations, foreign entities, and foreign nations, think we have this big gunboat diplomacy that we're going to take over the world and make them us. And the reason that they think that is not because of who we are as a people, and not because of the fundamental principles that this country is founded on, but because we don't follow them, and because we're not following our Constitution.
If you're comfortable, we will just move on to the next question. Healthcare ranked right in this same area that we're exploring here right now. And we did have a question on the survey. The folks here in attendance tonight, if you approved or disapproved of the current overhaul that is proposed of the federal healthcare system. 47 of the 74 disapproved, 18 approved, 5 did not know. The question would be in regards to the healthcare overhaul, support or not supportive of it, or are there components that you would be supportive of? Start with Mr. States.
Having voted no on the final healthcare bill, which is now the law, my answer is I'm not supportive of it. But it's a much more complicated issue than one which can simply be dismissed with, I voted no, and walk away. We desperately need healthcare reform in this country that works. 17% of our GDP is currently spent on healthcare, and in just a few years it'll be 20% if we do nothing. The quality of care we get isn't anywhere near where it should be given the amount of money we're spending on it. And it is putting American businesses, especially small businesses, at a significant competitive disadvantage in the international markets. The problem with this bill was it didn't do enough to adjust the primary problem, and that is escalating costs, which is the reason it's a crisis. It also paid for itself, I think, inequitably, in an unfair way. Basically, one of the biggest pay-fors in the bill was through a taxation, or a tax, on benefits, as though it were income. And so in the end, that would be asking, and it will be asking, the middle class to help pay for health care for the working poor. That's wrong. Now, in answer to the question, are there some good things in the bill? Yeah, there's some good things in the bill. The fact that a child can stay on his or her parent's policy until he or she is 26, it's a good thing. The elimination of pre-existing conditions as a bar against obtaining insurance, that's a good thing. See, I've seen too many stories. 55-year-old laid-off workers that can't get any coverage because they have a heart condition, they have diabetes. Elimination of the lifetime caps, also a good provision, because someone shouldn't lose their home just because they get sick. That's why I've been advocating for change in this bill, change that's meaningful, that keeps the insurance industry honest, change that brings down costs, and change that provides for an equitable pay for in the bill.
Two things come to mind to me right off when we're talking about the Healthcare Reform Act. Number one, it's not constitutional. The federal government has no constitutional authority to be involved in your health care. Number two, the federal government doesn't have any money. Pretty much that simple. Do we need to have health care reform? Yes, we need some sort of health care reform. I believe that health care should be handled at the state level. States can determine whether or not there should be a health care program to provide for those that can't otherwise provide for themselves. We all understand that, that there is that need. And several states have undertaken various different programs to try to do just that. Some of them worked, and some of them didn't. Some of them worked better than others. Many of you probably know about the state of Massachusetts. Their health care, take care of everything, didn't work out. It nearly, well, pretty much bankrupt Massachusetts. Same thing happened in Tennessee. However, Tennessee revamped their program, and it sort of became workable. But the point is since there's no federal constitutional authority to do it in the first place, let the people vote high determine that. And if you are for a health care where your taxes pay for everybody or whatever, it's determined at the state level. And then if it doesn't work, we can fix that at the state level. But when we've got it now adopted as a nationalized program at the federal level, we're out of options unless we repeal it. That would be one of my endeavors.
Well, just for the record, I want to make sure that everybody realizes that our Congressman Space voted for the House version twice before he voted against the final version. In my opinion, the House version was actually worse than the final version. We need to repeal this for just one reason alone. It's going to bankrupt the United States government. It's a lot more costly than what they said. It's going to erode quality of care. But we need healthcare reform, and the reforms we need is to address the escalating costs. And here's how we need to do that. First is tort reform, defensive medicine, frivolous lawsuits. We've got to eliminate that issue, take that away. We did some of that here in Ohio, medical malpractice insurance in 2005. I was part of that. Remember, we had doctors retiring early or moving to Indiana, and their medical malpractice premiums were going through the roof. Now we've got at least a dozen carriers right in that, and the costs are coming down, and doctors don't have that problem as much. Number two, portability. You ought to be able to buy health insurance across state lines. That brings competition to the insurance market because it brings a heck of a lot more carriers into the market. Number three, we need to have health savings accounts that work. Come in, the employer kicks in, you as an employee kicks in, tax before tax free, but use that fund as an account that stays with you for the rest of your life. That would be for routine and preventative care. And you have health insurance for if you have a major problem. So when you go in and have your annual checkups, you pay for that out of that account. That brings more personal responsibility. I think it enhances your relationship with your physician because you're going to have a more frank conversation about what tests you may or may not need. It helps the defensive medicine issue. But a big thing that helps, it will eliminate some administration costs because the physicians and their staff aren't going to be filling out a bunch of paperwork. And then there are people that don't have insurance. Some people don't want insurance, that's their right. But the people that are medically uninsured, we have to encourage the states to be the laboratories to develop group risk pools. There'll be some subsidization of that because we're paying for it anyway, so those people go to the emergency room. But if we can get them in the private insurance market and get preventative and more routine care, that's going to help drive down those costs, and those people are going to be covered, and it's going to drive down the cost to society because when they go in the emergency room, it's $1,000 probably to walk through the door, and the ticket keeps on, the meter keeps on ticking.